So this is how I understand the SIJ provocation test. So if you test them and you have if you have none of them or less than 3, negative, so you may have, so there's no involvement with the sacroiliac joint, and then you have to rule out other pathologies. However, you may need to do some activity, and then if the provocation tests are positive, then there may be instability. Then if you do the test and they are positive, then you should retest them again, but add a belt. Then with the belt, if the tests are negative with the belt, and then they were positive without the belt, they most likely have instability. However, if you do the test, retest with a belt, and then they are positive still, then you should suspect locking or sacroiliitis. So then we'll scroll down to this next chart. So then after you rule in lock or sacroiliitis, you should do the modified Gainsland's test for counternutation and nutation. So if the patient has a positive Gainsland test for a nutation and counternutation, both tests, then they're positive for both and most likely have sacroiliitis and further testing from there. But if the patient tests negative or only tests positive for one of the Gainsland's tests, then you suspect a locking of the joint. So you should manipulate them and then retest the patient. Retest them with the provocation test without a belt, and then without a belt. So then if you test them and then they have no symptoms, then they are they had a locked without instability. However, if you test them and they still have pain, then you would need to manipulate from the other side to see if they're still locked and then retest again, or they may have an instability, so you may want to check with a belt.